The tragedy involving Virginia State Senator Creigh and his son Gus, who, as news reports have it, committed suicide after allegedly stabbing his father in their Virginia home, puts the topic of the lack of beds at mental health facilities right in the spotlight. Well, we are Skyping with Dr. Daniel Lieberman, professor of psychiatry and behavioral sciences at George Washington Medical Faculty Associates. Doctor, how big a problem is it, the lack of beds for people who need mental health evaluations and help?
It's a very serious problem. It's not unusual to walk into a hospital and see people who are on stretchers in the emergency room because there are no beds available for them anywhere in the city. I have not heard before of people who need inpatient treatment actually being released, but as this tragic incident shows, that's an even bigger problem.
Now, there was a court order or a judge's order in this case, and yet couldn't be complied with, right? And is that something, that you don't hear about, or is that something that's happening far too often?
Well, apparently this happened 72 times in the past year or so. So certainly we're not hearing about it, but unfortunately it's not rare. And it's hard to believe how one could have a court order indicating that someone is potentially dangerous and is in desperate need of psychiatric evaluation and care, and simply have them sent out.
So why is there this shortage?
Well, there are many reasons for it. I think that to understand it, we need to go back to the 1960s when something called deinstitutionalization occurred. At this time, there were many, many state hospitals where patients with chronic mental illness were being treated over long periods of time, years in some situations. And it was felt that in some ways that this was not humane, that it would be better to close down the hospitals, get these patients back out into mainstream society, and treat them more in a community setting. It was a very noble goal, but unfortunately it didn't work. And what we have seen since then is these poor patients ending up in two places. The primary place is the prison system. And needless to say, this is far more inhumane, and it's also far more expensive. Another portion of them, though, are living out on the streets. And these are people who are often in the hospital. The average hospital length of stay these days is about 5 to 7 days, and that's not enough time to adequately stabilize them. They're putting this kind of burden on the mental health system that simply can't be sustained.
Well, can these patients be hospitalized elsewhere in the hospital?
Yeah, it happens, certainly. When psychiatric units are full, we often board them on other units, but sometimes these other units don't have space, and sometimes the patients are simply not well stabilized enough. They may be very agitated. They may be potentially violent, and general medical surgery units just don't have the staffing. They just don't have the infrastructure to be able to effectively manage these kinds of patients.
Is it so shocking because this happened in a home where a Virginia state senator, a man who has ran for governor, and yet he couldn't get the help he needed?
It does speak to the fact that we do have an egalitarian system in place. But it's true, if somebody like this is not able to get help, the kind of low-income or even homeless person with mental illness, they have much less of a chance of getting the help they need.
At what point should you be seeking help?
Well, the best place to get help is from an outpatient psychiatrist, because that way you can stay within the environment where you're comfortable, and it's just a lot less disruptive to one's life. But there does come a time when inpatient treatment is necessary. Now, this really is mainly when outpatient treatment is not working. A person's condition is worsening in spite of the treatment that they're receiving. It becomes much more of an emergency when dangerousness begins to emerge. And the dangerousness may be suicidal ideas. The patient may start saying that things are going so badly, I'm having thoughts that my life isn't worth living anymore. Or even worse, they're actually talking about ways in which they might end their life. In addition, there could be dangerousness to other people. They might start saying things like, I'm scared, I feel like I need to protect myself, and the best way for me to do that would be to attack some person.
So those are some signs that people should look for. Are there any other signs? I mean, sometimes you hear this thing about when somebody decides that they're going to commit suicide, that they reach a place of peace. Is that something that you see?
Yeah, there are a lot of warning signs. Some of them are more ominous than others. And as you say, reaching that place of peace seems to indicate that the person has made up their mind and they're no longer struggling within themselves. Other very ominous signs are when people start giving away their possessions, they start working on a will. These are signs that they're very close. Usually, though, we do get a lot of warning. There is this myth out there that people who talk about suicide aren't going to commit suicide, and it's the exact opposite. Talking about suicide is a clear sign that the person is at high risk.
You often find in any sort of medical situation, well, any situation, but certainly in medical situations, you need somebody to advocate for you. How much of a difference does that make? If somebody was sitting in there fighting, not that Creigh Deeds didn't do everything he possibly could do, but does that make a big difference?
It makes a very big difference. People who need hospitalization are in a very vulnerable situation. They're in no position to be able to advocate for themselves. So when my patients need to go to the hospital, I always tell them to bring a family member, and when possible, I try to call ahead in order to have a one-on-one conversation with either the emergency room doctor or the psychiatrist on call, so I can clearly communicate what the problem is and how it needs to be addressed.
And what is the situation at George Washington Medical Faculty Associates?
Well, we are very busy. It's not unusual that our inpatient facility fills up. It's in very high demand. I think we give excellent service there. And when that happens, we have ourselves in the situation of people coming in seeking help and are having to start calling around different hospitals in the area trying to find some open bed for them.
And this is a busy metropolitan, I mean, it's Washington, D.C., it's the nation's capital. In the Creigh Deeds situation with his son Gus, they were in Western Virginia, I do believe. Does that also lead to some of the problems?
Yeah, in some ways it's worse. I mean, we are in a busy metropolitan area. We have high population density, and so there is a great demand for medical services. On the other hand, we also have a little bit better supply than most places do. We have more beds. In a place like West Virginia, you're going to have very few options in terms of seeking psychiatric care. And so when you do have a resource, people are going to be driving potentially hundreds of miles to utilize that resource.
Any last pieces of advice?
I think that when people need mental health care, they should not give up. The family members need to continue to advocate until their loved one gets the care they need. And I think that this illustrates that in a very clear and unfortunately tragic way.